Dr. Shivam Gupta. Dr. Shivam will be speaking on a novel technique of post-traumatic cyclodialysis cleft repair by direct cycloplexy with Sioni ring.
Good morning to all. I hope I'm audible. So we are going to discuss a case of novel technique of post-traumatic cyclodialysis repair by direct cycloplexy with Sioni ring. So here is a patient, a 27-year-old female who was sitting below a coconut tree, and the coconut fall on her left eye, and she came to us with with the left eye appearing like a traumatic cataract. Her vision was 6/12, intraocular pressure being 18. We did a gentle gonio, and we could see occludable angles in the gonioscopy and anterior subluxation of lens and cataractus changes. There was a traumatic mydriasis present. So patient was underwent left eye phacoemulsification with acrylic lens, and a capsular tension ring was implanted in the bag. So post-op day 1 was uneventful, 6/24 vision, IOP 18, and PCIL was stable. But when we asked for a second follow-up, patient came with 3 millimeter pressure, PCIL was stable, but there was a traumatic mydriasis, and there were certain new changes that optic disc edema was there, and some ILM folds could be seen. So so we could see some cystic ILM folds and choroidal folds extending to from optic disc were seen. So what was this can be a diagnosis of post-traumatic cyclodialysis cleft with hypertonic maculopathy. So we did an OCT macula of it, which showed abnormal foveal contour, fluid accumulation interretinally with choroidal undulation suggestive of hypertonic maculopathy. So what is the reason for this? So let's do gonioscopy, what we might have missed. So in gonioscopy, because of the hypertonous nature of the globe, it was not well visible, but yes, we had to go ahead. We did a UBM, and here we could see a cyclodialysis cleft there. So to correct localization, we used an AIOCMT3 KCR2 to localize the cyclodialysis cleft, and it was appeared to be from 7 o'clock to 9 o'clock over here. So we went ahead and started on cyclodialysis diagnosis was confirmed. The patient was started on topical steroids. It didn't improve. Then we started still remained low, so we started oral steroids. After 6 weeks of initiating conservative therapy, it was not working. Then we started with cryotherapy was done, direct cryotherapy was done, but IAP was still 4 mmHg within the follow-up period. Now what to do? Now we have only to go ahead with surgical plan. So why not there were multiple surgical plans we could go on, like indirect, direct, or multiple options. So why not we planned a Sioni ring implantation. So here we implanted a double ring Sioni ring inside the sulcus. So yes, we achieved full success with it, with IAP coming back to 16 mmHg and anterior chamber well formed with and here after 2 months follow-up, patient had good 15 mmHg pressure, normal depth, PCL, and resolving optic disc edema. And so here we can see gonioscopy, nasal side, the area we were localizing, the cyclodialysis had appeared to be normal. Now the fundus is also looking normal. If you look at serial OCTs taken from September 23 to 1st March 24 after surgery, and recently taken yesterday only one scan was taken, you can see it has improved. So here was a KCR2 image before and after the procedure, and here you can see a cyclodialysis inside the cleft, and it's a angle 360 degree, and if you see this video, all 360 degrees, the cyclodialysis have been repaired. So what is cyclodialysis? We all know separation of longitudinal fibers from liver and cell spur. So what are the multiple options? It can be traumatic or iatrogenic, and so we can have ab external approaches, and here we have ab internal approaches of single suture, and like what is special of our technique, we would a double Sioni ring, which has a 2 run, one will give the endocyclotamponade, and other ring will give a direct cycloplexy effect, pressurizing the cyclodialysis cleft. The limitation of our procedure being there are high chances of ciliary body erosion, hemorrhage, pain, and inflammation, and longer operative time because it's a new procedure, and inadequate sulcus support can be there, and there is also the learning curve for that. Thank you.
Very nicely managed. That means you have to do, in traumatic cataracts, you should do a gonioscopy compulsorily. And secondly, was there any zonular dialysis along with this?
Sir?
Was there any zonular dialysis?
Sir, actually, during it was some anterior subluxation of lens was already there, sir. And yeah, you're very right, sir. We should have done a AIOCMT pre-hand also, or at least an UBM beforehand. Second thing, while doing the phacoemulsification only, due to the anterior subluxation of lens, we placed the CTR inside the bag.
Okay. Thank you.
Thank you, sir. Thank you.